Welcome to another episode of the Safer Roads podcast, the home for honest conversations about road safety in Zimbabwe. My name is Webster Jaricha. I'm your host. Today, I have a guest in the house, Mr. Webster Jaricha from Concert. He is our guest for this episode. Welcome, Webster, to the Safer Roads podcast.
Thank you very much, Mkoma Tawanda. Well, hello, Zimbabwe.
Right, let's delve straight into our discussion for the day.
Yes.
Tell us, who is Webster?
Mkoma Tawanda, Webster is an ambulance technician and now gone first community first responder, being the founder of an organization called Convergence Community Emergency Response Teams, which is a community initiative which was founded primarily to offer pre-ambulance, life-saving pre-ambulance first aid in the event of an accident or an emergency alongside the road. Being an ambulance technician with over a decade years of experience, having gone through different ambulance services, working and training as well, I acquired quite a number of skills and knowledge in terms of pre-hospital care or pre-hospital services, which through using that knowledge allowed myself to be able to initiate or to start up Concert, which is going out there to help and assist in emergencies.
Okay.
Yes.
Tell me more about this. What is it that pushed you to say, I need to set up this organization?
Yeah. So what happened, I think, is just there was a growth, which sort of like a plague, which was there, where if an accident was to occur, or panenge paita accident, paipa Mkoma Tawanda, onza zvichinzi vanhu vakafa, nekuti vakatadza kubatsirwa. The reason being, obviously, maybe the system could be overwhelmed, whereby now we are reliant on private services. So private services being profit-oriented, they were asking for money upfront. So when you would call for an ambulance with guys, they are bleeding, and this is coming from a lay person, people would ask for money upfront. So against that background, I sat down and I said, look, Inina, I can't live with that. And I took it upon myself. It's just a natural conviction. Ndakazongona takutanga kubuda china kunobatsira kuma accidents, and slowly now coming up with a need to say, tikatanga kutrain my first aiders across Zimbabwe into the communities. And that's so us now starting to train my communities, different, my neighborhood watches, my gardeners, my maids, because often they're close to the incidents, to be able to then assist. So through that system, it started with us setting up a WhatsApp group for them to notify us and also be able to give, additional information, to then evolving into a full service where now not only do we give information, not only do we train, but also with a system that notifies us of an emergency and which allows us to then send out first responders to be able to go and assist and stabilize before the arrival of an ambulance. Yes.
What's exciting about this whole thing is you didn't talk about anybody, pouring in some money into this project. You just said, I need to do this. How did you start? Did you have any form of the funding for you to start?
Mkoma Tawanda, since 2021, much of the funding has been coming out of my pocket. To be honest with you, how it all started, I think it was just post-COVID. COVID towards the end of the COVID season, and then right up until afterwards. Pangwita I need. You know what? Vanhu vari kufa. And in my background, obviously being in emergency medical services and also being part of training schools, I did my training with Mars. I worked with various companies. I even worked in South Africa, as well as now working for companies like AC and Ambulance. I had gained so much experience, and I said, okay, fine. Looking at a situation where I'm but I can positively affect by just being there.
Okay.
So I saw myself 12 midnight waking up, to just go and help, because people would call me because I was in training department. Webster on an accident. Webster on Nakararam Road. Webster Pafa on Wakat. And I would say, guys, we need an ambulance. Who is paying the money? So times like that, I would just say, look, I can't do this. got into my car, found myself that upper scene, and with my small little, first aid kit, I take a first aid kit, kagane 3 my pouch, and just helping that. But this can actually improve the chances of survival, and nema resources where masho bangari po takatotanga batsira vanhu kobata what.
All right.
Yes.
My next question was going to be, so is it a calling or I'm not going to ask that.
Definitely a calling. Definitely a calling. It's definitely
a calling.
Yes.
And I always say, if Zimbabwe had a lot more people like you, hey, you would really make a huge difference. Because the model you're using, take us through that model, Yema WhatsApp groups, and how does it work?
Right. Yeah. So just taking you back a bit, and that's it. We would go into different communities, like I said, the neighborhood watches, as well as even the maize, the gardeners. Okay, after having trained them, let's open a WhatsApp group. So initially I saw myself on like 50 WhatsApp groups because each community had its own WhatsApp group. Then I said, okay, let me take the initiative upon myself to set up a WhatsApp group, which we then named Convergence, Health and Safety, which was the parent company, and then Community Emergency Response Teams, which then meant the community which will be there to respond to these emergencies.
Okay.
So having done that, we set up our first group initially, which was group number 1, where again, people would ask questions, and then everyone would benefit from that question. And then if ever someone was in need, they'll then be able to let us know. And then we give them instructions over the WhatsApp and also then be able to coordinate all the necessary responses. The reason why we were using WhatsApp was simply because, we're living in a modern society where things are changing. We're moving towards digitalization.
Okay.
And you'd find that WhatsApp is one of the most widespread or used tools everywhere. Even WhatsApp, Mabasa, we're using WhatsApp. And I said, and also this is the most affordable. WhatsApp. So if we create a group, no one gets to be charged to join the group. No one gets to be charged to send a message on the group. But at the end of the day, we get to invite all the various stakeholders to be part of that group. So that not only does Webster get to know about the emergency, but also the other stakeholders who are then able to respond would be able to get timeless activation in the event of an emergency. Okay. So we just kept it simple. And to the best of our knowledge in terms of IT, that made, it was quite a simple, I would say, initiative to set up.
Texting while driving. What a dangerous thing to do on the wheel. Be smart. Put the phone down. Don't text and drive. This message is brought to you by the Traffic Safety Council of Zimbabwe. Safety first. There is no second chance.
Yeah.
And how are you getting this message across to the Zimbabweans in all provinces? What is your coverage like? Is it 100% coverage in all 10 provinces, or it is still confined to certain provinces?
In Komatawanda, recently I saw myself in Mount Darwin, where there was a lady who was marooned, and we found ourselves being activated at about 10 p.m. And within 45 minutes, we were already en route to Mount Darwin. We got there at about 3 a.m. And with the team which I had gone with also the help of the sub-aqua unit, ZRP, we were able to rescue this woman. So in terms of our coverage, I believe we are covering the entire Zimbabwe. Where we are not able to be there physically, we've got our communication systems, which are then able to at least notify whichever relevant emergency management service area imomo to be able to then, promptly respond. Sometimes our emergency management services are not respond simply because they have not been activated. Why? Because the majority of people do not know who to call. They do not have the numbers, and perhaps they do not even know that such services exist.
Okay.
So where we found ourselves as Concert, we found ourselves at the center of coordination, whereby we're saying, in our terms of our coverage, we cover the entire Zimbabwe, but at the same time, also we're able to pull in resources where we're not able to be there and notify the relevant authorities or the relevant emergency management services to go and assist.
Okay.
Yes.
Tell me about your challenges from day one up to today. What are the challenges that you have faced as a Concert? I mean, those challenges that are affecting you to meet your objectives as Concert.
So the first thing I would say, much of it has been on a financial aspect, because, like I said, much of the funding has been out of my pocket. But initially, as we started, yes, I was by myself. And then I then later incorporated or amalgamated, joined hands with Mrs. Patricia Townsend, who then came on board, and together we sort of like then expanded our wings, and we're then able to support each other and seek funding from different communities, which then saw us being able to meet, our obligations. But I think financially, yes, that has been the most challenging aspect. Biggest challenge, because the fuel we use, the airtime we use, even the vehicles. I remember I got a new vehicle, and my family never really has had an opportunity to enjoy that vehicle, because that's the vehicle I've been using. 24 hours a day, that vehicle is running. Even at very odd hours, so
doing concert errands.
Yes.
Okay.
So it has been that. And then obviously equipment, where, for example, sometimes we failed to actually get an ambulance, we've had to, I think the longest time I've ever done CPR was 55 minutes. And we were still waiting for an ambulance and calling for an ambulance. And we kept the victim alive up until then. Eventually we managed to get an ambulance that took the person to hospital. The sad part was that, the unfortunate part was, we then lost the victim the next day. But we had done our part. Had it been a situation where Concert by itself as an institution had its own ambulances, we would have been able to provide prompt, evacuation from the emergency scene to Chimwendesa Hospital, kutagona kubatsiro.
The first thing that, from what you have just said, there is the family. You mentioned the family. They
Yes.
would my errands, and maybe they have to use alternative transport because you are out using the family vehicle.
That's true.
How is the family taken that? Because your job is basically a 24/7 type of job.
That's true.
So take us through that.
My family, I would say, is God sent. Mwari ane marongera anta zvinhu zvake. Anokupa munhu anonzwisisa, anokupa vanhu anoappreciate basa. My youngest daughter is 3 years old. She's turning 3 this year. Chengeto. Anoti kana akandona ndakupfeka. She knows when it's an emergency, because usually 2 minutes I'm out of the house. So to get such a family is something that's divine. It's remarkable. My wife is very supportive. Every night she actually, puts aside clothes, kuti nasinto kupfeka tracksuit, nema safety shoe inechi, because she knows usually when the call comes in, any time of the night, I have to be out in 2 minutes. Sometimes I've seen a wake up, I just want to knock my doors, kuti manye. And by the time I come back, all these guys, my family is sleeping, but they've been very, very, very supportive. And I thank God for having, given me such a family that supports the work that we do.
Okay.
Yeah.
We'll take a short break. Webster, I still have a lot of things that I need to learn about concert. Viewers and listeners, our guest today is Webster. He's taking us through his hectic schedule. We are taking a short break. Remember to share, like, and subscribe to the Safer Roads podcast. We'll be back in a moment.
Musa, a young person always on the go, just like you. Unexpectedly, life can take a sharp turn. But not to worry, Zimnet's breakdown cover gets you quick roadside help. If need be, Zimnet's emergency evacuation gets you the care you need fast. Hospital cashback and vehicle repair relief cover will cater for your medical costs and rental car in times of need. With Zimnet, you're always covered, wherever the road takes you. Drive with confidence, drive with Zimnet.
Welcome back to the Safer Roads podcast. My name is Mr Sisimayi. I am your host, and our guest today is none other than Webster, the founder of Concert. Welcome back to the second segment of the Safer Roads podcast.
Thank you for having me.
I've got some worrying statistics here, Webster. The ZRP reported that between the 15th and the 16th of 15th and 26th of December 2025, 2,412 road accidents were recorded. And that was nearly double the stats for the previous year. And 100 people were killed. 37 of those killed were pedestrians. What was the festive season like for Concert?
So our festive season was relatively busy. But though we had much of the call-outs, during the evening times, and I think it resonates also with the escalated number of pedestrians, being hit, obviously due to a number of reasons. But in terms of our operations, it was relatively busy, I would say. Relatively busy, yes. Yes.
Tell me, what went wrong? These numbers were shocking. What went wrong this
festive season?
What went wrong?
I think in totality, or maybe if we look at it generally, right? We're looking at the mood, festive season mood, where obviously people are drinking, they're celebrating, they're traveling with to see their loved ones and spend time with them. But also with that comes an overexcitement, overexcitement on the part of the drivers, overexcitement on the part of the pedestrians. Because, when you look at matters to do with road safety, we look at them from an angle whereby we say it is everyone's responsibility. And by so doing, which means if I'm a pedestrian on the road, I have to be extra cautious and use the allocated walk areas as opposed to walking, on the road itself. If I'm a vehicle operator, I need to then be cautious and also, be courteous in terms of being able to be considerate for other road users, which are the motorcyclists, which are also the pedestrians. So without all this consideration put in one goal, the numbers are bound to escalate. Topped up with alcohol toxicity, drug and substance abuse, human error, negligence, among many other things, it definitely, would increase or cause the numbers to actually go up. If you look at the majority of the pedestrian vehicle accidents we went, obviously after asking questions, it was all attributing to poor visibility, the rains, speeding, and as well as in terms of poor visibility, after time you'd find the pedestrians wearing darker clothing, Whereas if you're traveling at night, you could wear brighter clothing, especially like the one I'm wearing right now, which allows for motorists to be able to see you. And also people walking on the road itself and, where the driver doesn't expect to see a pedestrian in the middle of the road. I think pretty much that would contribute to, we're contributing factors.
So tell me, what would you say needs to be done to start getting these numbers to go down? Because we've got this United Nations, the decade for action for road safety. The target is to halve the number of road traffic fatalities and injuries. And our numbers in Zimbabwe are going up. So what should be done?
I think, personally, what I would recommend is that we as a nation, we as Zimbabweans, get to a point where we complement our government's efforts. If you look at our government, I think over a few decades past, they've really put in a lot of work in rehabilitating our roads, being able to put markings on our roads, being able to put traffic lights, on our streets, as well as lighting. So when we then say it is up to us as Zimbabweans to partner with our government, I'm thereby saying and calling upon each and every Zimbabwean to take the initiative to say, what can I do better to contribute towards, making our roads safer for everyone. So, you're looking at a situation where we're saying, if you're a driver, you just consider that Ndirimu road, the road driver seeing me. I'm moving using a mechanical equipment. Surely when I cross a road, can I not slow down? When I who's on the road, you can say, but sure, driver, check road, oh, and this across a road in Chimanya. Do cross a road down out road, it clear. And, again, it boils down to issues of I would say it centers on behavior and attitude. You know, when laws are put in place, do not drink and drive, they are not there to sort of like, you know, punish people. Usamwe doro sana kids. Rako, but kanoma doro tora in drive. Mazanoti in drive with all this, you know, be responsible. Kana ona kuti, you know, wakatako even with on foot. Chicha gumona nuku perekets imbo gara orare imbuma mvura. You know, look for something to eat. So the only way, you know, we can improve, you know, or maybe perhaps reduce these numbers is if each and every Zimbabwean was to take it upon themselves to say, you know what, I can do better. I can be better. And I'm not being better for myself, but I'm being better for the next person who's next to me. Now, the person I'm going to kill, the person I'm going to kill, the person I'm going to kill is, you know, my neighbor. And what does the Bible say? We should love one another,
yes,
you know, and you have to love your neighbor as well.
Yes,
yes, sir.
Okay.
All right.
Right. Thanks for those recommendations that you have there. Let's talk about emergency numbers. If the other day I was just asking people that, okay, if there's an emergency, which number are you going to dial? And people were, the people that sample that I had of people that I was asking, nobody managed to get the answer right. And that points to the fact that we have a problem there. Take us through that. What needs to be done in order for us to have one number that can be accessed from any network in this country?
I think the idea of a national emergency number is critical. We need to lobby for a national call center, which stands independent of any service, but being able to have access to all services.
Okay.
Because, for example, right now we've got the recently launched 591 for ICZ. That is quite a remarkable, you know, effort. And I'll tell you that it's been very, very instrumental. Again, in I would say reducing the numbers. I'm sure the numbers even for the first citizen would have been more, you know, especially in terms of the fatalities. But most people were saved because, you know, this the ICZ had launched the 591 number, and also, you know, that being a national, you know, initiative, which number was open to everyone. You know, such an initiative definitely would work, as opposed to having individual, you know, service numbers.
Okay.
The other challenge, we have a lot or perhaps a number of private players. And each private player will have their own specific number, and they've got their own specific, you know, target market. So if it's someone who a specific, you know, private service, they may not be able to get a service.
Okay.
But whereas if we have a national number as such, the 591 number, where independent of whether the person is in Budiri or Mbare or Brodo, Brook or Winzidel, if they just call that number, they are guaranteed that, you know, a service is there, which is what we've done as Concert.
Okay.
When someone sends a message onto our WhatsApp, which every Zimbabwean, any person is able to join for free. They join our WhatsApp groups
for free.
For free. Right now, we've just started recruiting for our 9th WhatsApp group because all of them are full. So when you send a message on our group, even a small dot, even just gibberish, we've got a control room that's functional 24 hours a day, which is there to be able to then respond within 30 seconds. They'll call you to say, what is the nature of your emergency? Are you okay? We've seen that you've reported something. So let me just say I've seen an accident, maybe along this particular road. Immediately, we contact the nearest traffic police station that responds to that area. Number 2, we contact the nearest ambulance service. And then while that is happening, our first responders, if it's in Harare for now, our first responders are going. If it's outside, then we look for local resources, you know, which are closer to you and able to assist.
Okay.
Accidents happen when you least expect them, but help is just one call away. Dial 591 for free accident assistance anytime, anywhere in Zimbabwe. Need help at the scene of a traffic accident? Dial 591 for fast, reliable assistance toll-free. One call, instant help, zero stress. Say 591 in your phone now, because when the unexpected happens, you'll be ready. 591, serving lives, one call at a time. Brought to you by the Insurance Council of Zimbabwe.
Tell me something.
Yes, sir.
If you had an opportunity to, you know, We have a face-to-face a sit-down with the Honorable Minister of Transport and Infrastructural Development and the Minister of Health and Child Care. What are the things that you would say to them? Things that need to be done to improve post-crash response in this country?
Right. So first and foremost, I would thank them from the bottom of my heart for the already existing infrastructure. Things could have been worse. We've seen their efforts. I, for one, will acknowledge their efforts, and which is the reason why Concert is there to compliment and appreciate their efforts.
Oh, yeah.
The second thing I'll then say is, obviously looking in mind, or having in mind the Road Accident Fund, I would implore them to channel such funds towards rehabilitation of our public health system.
Oh, yeah.
So, for example, if you're looking at road, the only way we can mitigate Mishika and Makombi, some of the drivers, if you see them, other people will actually be kombi, and driving, and they're very insulting, and that, the only way we can get rid of that, let's have our own, bus line. Let's have a bus line like on a Metro South Africa or anyway, where we've got a very dedicated, transport system that takes people from the homes to work and then back. When you're looking at even our local hospitals in Zimbabwe, we've got the finest nurses, we've got the finest doctors, and we've got the resources, we've got the the infrastructure which is there. I would say a rehabilitation or complementing system to the already existing systems would help.
Okay.
So, for example, with such funds like the Road Accident Fund, if they were to be channeled towards perhaps getting ambulances for City of Harare, right? Getting the public transport system viable, and then lastly, being able to rehabilitate even our casualty department. That alone can improve, can improve the system and complement, each individual effort and help in eradicating, fatalities post crash or after any incident.
It did indeed, Webster. So if I was to say, my brother, as Concert, we really appreciate all the work that you're doing. What are those gaps that are affecting effective delivery of your mandate as a Concert or your mission as Concert? What are those things that you'd say, if I get this, Tawanda, I tell you, we'll be able to be more effective?
Mkoma Tawanda, it's also our business is about primary response. Our business model is about being there first and assist while the ambulance is coming. We as Concert are not looking at reinventing the wheel, especially in terms of the ambulance systems and so on. No, we actually want to be the nut before the wheel is put on the vehicle.
Okay.
So we want to get there and we want to stabilize the casualties.
Okay.
The things I would call for or perhaps cry for would be things like response vehicles. Our model already has proved that we don't need an ambulance. As per se, we need the small response
That's not your
vehicles.
core business.
We need the small response
All
vehicles.
right, all right.
So having the small response vehicles allows us to be fast, allows us to maneuver through traffic, allows us to be able to place them in different places.
Okay.
Now, this would be the first approach I would have. I would ask for response vehicles. The second part now is, obviously having gone through a number of challenges, where, like I was saying, we had to wait at the scene for 55 minutes trying to keep someone alive. I remember that particular incident, each time we'd stop compressions, you'd actually see the guy going, and we'd continue, and we kept doing that. Shit. I had my shirt off, as in, because we kept going. And, if we were to have at least 2 basic life support ambulances to just back us up, where maybe other ambulance services are busy, our 2 or one of them would be able to say, okay, look, guys, go, and then pick up the victim and take them to hospital. Okay. That would ideally help us. And obviously, we've got running costs, we've got the fuel costs, we've got, equipment, we need bandages. Those are things that I would definitely, obviously ask for, and they would help in a number of ways, in trying to help us further, pursue our agenda. While I'm on that, I may also comment that other stakeholders have risen to the challenge And I would mention the Highway Emergency Management Services, which has been there since December. From December, they went out in full force, and they did, they've really made life for Concert much easier.
Oh, yeah.
So you find that, especially with HEMS, where, you'd call other ambulance services and they'll say, no, we don't have money. HEMS actually called us and said, Concert, we appreciate what you're doing. We've dedicated 6 ambulances to respond to emergencies. All we need you to do is just to cry.
Okay.
And to date, Mkoma Tawanda, there were times that I would never rest. I would do 24 hours in Bus. Mkoma Tawanda is not on time ago.
Okay.
Because Webster, would I help? To write
Partnership with HEMS.
HEMS, Mangay. HEMS over Tatoshika Pasin. What don't the Mapurisa even anyone have phone at Pasin? What don't the ambulance is here, and they've been very responsive, very professional, and whatever they're doing, I can only but say, keep up the good work.
Oh, great.
Yes.
Interesting there. I think what's coming out there is that you can't do it alone. This crisis that we have in the country requires team effort from different stakeholders. It was a pleasure having you, Webster, for this session that we've just had. We could have gone on and on. I think there's a lot that I need to learn from Concert, and I really appreciate, and I'm sure viewers and listeners do appreciate the great work that you're doing. It was a pleasure having you today, and we look forward to having you in another episode in the future. So thank you so much.
Thank you.
Viewers and listeners, we have come to the end of today's episode. We were with Webster, the founder of Concert, doing great work there. We will definitely call upon people who can come through and support this initiative. You can do something. You can do something to help reduce the carnage on our roads. Once again, thank you, Concert, and to viewers and listeners, thank you for the session today. Like, subscribe, and share. We look forward to meeting you in the next episode. Thank you.
Thank you.